That's right. Today we are going to focus on what we are calling the South Asia roundtable. Remember, 20% of the world's population lives in the SAARC area. And yet, when you look at the total number of cases, we are doing much better than most other parts of the world. What exactly is the reason for our success? I'm going to be joined from Nepal by Dr. Runa Jha, she's Director, National Public Health Laboratory, by Lieutenant General Shavendra Silva, Commander of the Sri Lanka Army and part of their task force on COVID, Dr. Naseem Akhtar, Pakistan Institute of Medical Sciences, also part of their COVID task force, Professor Dr. A.F.M. Ruhal Haq, former Health Minister of Bangladesh, and Dr. K. Srinath Reddy, President of the Public Health Foundation of India. It's great to have all of you on the show. I'm going to come to you all in a minute, but first let's take a look at why we are making this our major talking point. Remember, for years, for decades, South Asia has been dubbed as a region that lacks health systems. It is seen as a region that has the largest amount of people below the poverty line, and yet it has outperformed the West, Europe and America when it comes to the COVID fight. What appears to have worked in favor of South Asian nations, some say, is the timely imposition of the lockdown. Others say a younger population. And there is the immunity theory. What really explains the fact that South Asia is getting it right, where the mighty United States and Europe are getting it wrong? It's our top story tonight.
COVID-19 has redefined the global order and supremacy of nations and regions. While the West and the Far East are experiencing the worst of the pandemic, South Asia has fared much better. But how has South Asia done that?
India has started later than other countries in terms of actual exposure, but it has managed to contain the dissemination quite well. And we definitely need to ramp up our health systems and social systems further.
It's not just affirmative policies, but lack of sturdy public health systems in South Asia that forced the governments in the region to order lockdowns. And it did make a difference in India, Bangladesh, Pakistan, Sri Lanka and Nepal, where lockdowns started in the last week of March. The common purpose was to break the chain of transmission through physical distancing. In Pakistan and Bangladesh, there is a fear of increase due to violations of the lockdown during the holy month of Ramzan.
कि अल्लाह के घर में जो बीमारी होती है ना, ये असर नहीं करती. अल्लाह के घर में शिफा मिलती है. यहाँ पे बीमार भी आता है ना, वो तंदुरुस्त हो जाता है.
The other important factor is the age median. Compared to the West, the average age of population in South Asia is under 30. COVID-19 is known to affect the vulnerable lot, the elderly.
कोरोना के वायरस की जो सीरियस मरीजों की फैसिलिटीज़ इस वक्त शहर में वो तकरीबन अपनी मैक्सिमम कैपेसिटी पे ऑलरेडी आ गई हैं, जबकि अभी ये मर्ज ने पीक नहीं किया है. अभी हम जो ग्राफ के इस तरफ है उल्टे हाथ.
And while the region can pat itself on the back for having handled the coronavirus pandemic well, there is much left to say about how it would manage the impending economic crisis. SAARC should not only look at an emergency COVID fund, but also focus its energies on economic relief. Bureau Report, India Today.
Okay, so we set the stage for the South Asia roundtable, the first of its kind since this COVID-19 outbreak has broken. We are trying to melt borders. The big question is South Asia outperforming the West? What is working for South Asia? Is it too early to deliver a verdict on this South Asia versus West battle in a way against COVID? Let's turn to our panelists, and I want to go first to Pakistan, to Dr. Naseem Akhtar, because we want to get a voice from Pakistan at the moment. First of all, happy Ramzan to you, sir. I want to understand, you're in charge of the COVID-19 isolation ward at the Pakistan Institute of Medical Sciences. How would you describe the situation in Pakistan today? Is it fully under control? I see the Gallup poll has given Imran Khan's government about a 60% positive thumbs up.
Yeah, thank you so much for inviting me. And I think, as far as Pakistan is concerned, our first case was reported on 25th of February.
Right.
And since then, the number of cases has gone up to now 12,227. And so far, 256 deaths has been reported. Um, I think it's very early to say that the number of cases is low at this moment in Southeast Asia, and especially if I talk about Pakistan, I think it's a bit earlier on. It's a bit early to say that we have less number of cases. But one thing is that after the outbreak started at Wuhan, I think we learned a number of lessons from the world, so that we were able to take few steps. I think the
How
most
quickly-
important thing was
Yes.
the social messaging that we were able to convey our general public, that how to avoid the dissemination of infection among the population.
But how
still, I
successful-
feel
how
that,
successful were you, Dr. Akhtar?
the testing capacity needs to be increased in most of the areas, because up till now, I think it also depends upon the testing capacities. If you are not testing much of the population, you can't say that your number is less. But still, as I can tell you that up till now, we are not receiving so much deaths as we heard in other part of the world. But I think there were a number of
Right. Okay, we're going to try and go back there to Islamabad, because remember, we want to connect. We are connecting all the capitals in a moment. Let's go from there first, next to Sri Lanka. Welcome to the show, Lieutenant General Shavendra Silva. You're commander of the Sri Lanka. You're a commander in the Sri Lanka Army, but you're also involved in this fight against COVID. Give us a sense of Sri Lanka, because you have just extended, I'm told, your lockdown by a few more days. Are you a country now still completely under a lockdown? Are you thinking of opening it up? Because when I look at the numbers in Sri Lanka, they're not bad. Confirmed cases 420, deaths just 7. And this is a country which has a high amount of contact with the Chinese because of Chinese investments. How have you achieved that?
First of all, thank you very much for National English News Channel today, India Today, for inviting us to discuss about how South Asia is fighting against COVID-19. Of course, yes, I have done well so far. Of course, we had a very good strategies from the beginning. His Excellency the President Gotabaya Rajapaksa established prevention of COVID-19 task force well before the first patient was found in Sri Lanka. It was on the 26th of January where the task force was formed, and thereafter the first patient was found on the 11th of March. But we got experience before that because with the Wuhan situation, where we had to bring 34 students who got stuck there. So thereafter, we sent a flight from Sri Lanka all the way there and brought them. Then the word quarantine came to Sri Lanka for the first time, and the task was given to Sri Lanka Army, where we had to put up a quarantine center within 48 hours for these students, and they are our future, the students.
So you've got, can I just stop you? You've enforced the lockdown and the quarantine through the army. Am I correct? That you had the army enforcing the quarantine?
No, it is not like lockdown. Army got involved in establishing quarantine centers. Not only army, for that matter, all three services got involved. Totally quarantine is done by the Thrive services are involved in that. So we started off establishing quarantine centers on the very first time when COVID before COVID started, where the Wuhan students brought. Then thereafter, when on the 11th of March, just before the first patient was found, the government of Sri Lanka around 7th of March, the first patient was found on the 11th. But before that, about 4-5 days before, Sri Lankan government announced 3 countries, Italy, Iran and Korea. Those who are coming from those 3 countries will be quarantined, whether locals or for the foreigners. Okay. So we started off with 2 quarantine centers established. And thereafter, with a lot of Sri Lankans wanted to come back to Sri Lanka, we increased the number of quarantine centers. We
Can
went
I,
up to
can I ask you though
Yes.
that you have been under lockdown since the 20th of March. You were supposed to lift the lockdown on the 27th, 2 days from now. I'm told now because of a surge in coronavirus cases, 46 new infections just yesterday, you've again postponed lifting the lockdown. Till when will Sri Lanka be under a lockdown, General?
Sri Lanka is not locked down. Sri Lanka is open. Only few districts out of, it's almost like 75% of Sri Lanka is totally open.
Right.
Only not even 25% is kept locked down. We have identified the areas that to have found the most number of COVID cases. Those are kept under lockdown.
So you've kept 75% of the country open. You're focusing on the areas where the numbers have increased. That's about 25% of the country. Very interesting the way Sri Lanka has operated. Also the use, as you said, of the army in establishing quarantine centers. Let me go from there to Bangladesh, to Dhaka. Professor Dr. Ruhal Haq, you're the former health minister. Give us a sense of the Bangladesh numbers, because again, this is a country which seems to have outperformed. There were fears that it could spread in Bangladesh, again strong links there with China, but you seem to have relatively got comparatively decent numbers in terms of being able to control this. Is that because the average age is lower, as some are suggesting in Bangladesh? What's the reason for the relative success at the moment?
Thank you very much. I would like to say hello to everybody in the SAC region and happy Ramadan and salam to you all.
Yes, happy
Thank
Ramadan
you for
to you.
connecting me. Thank you for connecting me. It's a great occasion. I think we should do this more, then we can know each other a little bit more about the whole situation. I think Bangladesh got onto the wagon quite early. From the very early days in Wuhan, we came to know that this is going to happen, and we were warned, and Bangladesh went into the very early preparation. We started the screening of people coming from abroad, especially from China in the beginning, then from Europe and other countries, especially in the airports. And you probably do know that a good number of students from Wuhan came to us very early, and they screened and kept into a place for 2 weeks before they were allowed to go home. So we were preparing ourselves from the very early time.
Right.
Our primary health care, I think you know that is much better. I think we can compete almost with Sri Lanka. They are also doing very well, but their numbers are very, very good. I am very surprised, and congratulations to you. Our numbers are, you know, that we have 140 deaths so far, 9 today, and about 4,000 plus people been affected. Our testing sites is getting more and more. So probably as we enlarge the test, we might have few more.
Is that for a moment, if I may stop you there, is that, Professor, one of the problems across South Asia? We're not testing enough. Now, if I had someone from New York on the show, or someone from London in this South Asia observing this South Asia roundtable, they will say, look, you're celebrating prematurely because you're not testing enough. Do you agree, Professor?
I totally agree. I totally agree. But there again, one thing that you have mentioned a little bit, this needs to be explored very well. Probably the weather, I'll say probably, I had some reports, is probably the humidity and the temperature might be disfavoring the virus. Otherwise, the whole region, as you see, we are not very good in the health management, and our health management is not as good as the West, but they are struggling so badly.
So you're saying primary health system is strong. You have a younger population. You prepared early.
Younger population.
You prepared early.
We prepared early. We have started the lockdown quite early, and then monitoring the.
Is your country now fully under lockdown, Professor? Fully under lockdown?
Our whole country is fully under lockdown. But like in India, as we see in reports, the problems of the common people, they don't understand, they don't want to follow. Right. There are poor people who don't have rice and curry, so they want to come out. So there is a big problem in the whole region, I am sure. That is one of the big region that we are facing, and that is economic part of the COVID probably will play a very big part.
You know, we will discuss the economic. We'll discuss the economic fallout on another day. I want to focus at the moment, of course, on the numbers. I want to go to Dr. Roona Jha, your director, National Public Health Laboratory there in Kathmandu. Nepal's total confirmed cases as of today stands at 49. Just one, not a single death reported. 12 have already recovered. What's the success story? What's been your experience in Nepal?
Thanks for inviting in the show. The first case in Nepal was detected on 24th January 2020, and the second case came on 23rd March. So I think after 24 January, we got a lot of time to think about how we can fight with Corona. We all knew, we accepted that our healthcare system is not that strong, and if it comes like it had come in Wuhan, we won't be able to face it. So our whole focus was present on how we can prevent Corona from entering into the country. And immediately after a few weeks, we had to rescue about 175 students from Wuhan, and they were quarantined for 2 weeks. And that quarantine system was like it was given a lot of media attention,
Right.
and that spread the message of quarantine to the lower levels. So even our local governments and our household people, they started understanding what quarantine is, why it is important to contain the virus.
Well-
So our whole attention was somewhat focused on containing the virus. And I think although it is too early to say that we are successful, but I think that helped a lot.
Okay, so you started early again and you recognized that the virus was something that you needed to act quickly. It's very interesting what's happening across South Asia. Remember this at a time when the Western world, United Kingdom was experimenting with herd immunity. Donald Trump was dismissing reports of possible COVID pandemic. South Asia was acting in the months of March and April. I want to come to you, Srinath Reddy. We've gone to all our guests across the region. As good hosts, we've come to India last, Dr. Reddy. What's your sense?
Right.
Is there a common thread you're seeing across South Asia? Is there a thread that can tell us at the moment that maybe as of today, we are a little better placed than the rest of the world? Or is it too early to say, given the fact that some epidemiologists believe that the worst is yet to come?
Well, I think we are in a better place, though we have to prepare for possible resurgence in the winter. Apart from the fact that we do have a younger population, one factor that's been missed is that we also have, in general, much larger rural populations than the OECD countries of the West. And mobility is much less in rural areas, much more in urban areas. And the human agency is very important in terms of the virus mobility as well. The virus hitchhikes on human mobility. And when rural mobility is much less, the spread is much lower. But there are other factors as well. We do not know about the temperature and the weather. Possibly they are likely to be supportive. But we have also been primed very much for infectious disease response with H1N1, with H5N1, as well as with Nipah, for example, in Kerala. Our health systems are better tuned to that kind of a emergency response with better contact tracing. And we also have, in general, in our countries, much greater degree of community participation in primary health care. So whether it is contact tracing or isolation, the community participates, as best exemplified by Kerala, but I'm sure it's true in Bangladesh, Sri Lanka, and other countries as well.
Right.
So there are multiple factors which have actually favored us. And I believe that we are doing better because of a confluence of all of these factors, though we do need to do a lot better in terms of strengthening health systems. But just on the issue of testing, Rajdeep, since this comes up so repeatedly,
Yes.
firstly, if you have a full lockdown, you are actually isolating everybody who is potentially infected or their contact. So the purpose of testing, which is essentially isolation, is being served.
Right.
More importantly, other than South Korea, there's very little correlation between the number of tests done as well as the results. If you look at Asia's success story, it is Vietnam actually, which has controlled the epidemic the best results.
Sure.
And
In fact, the Vietnam leadership has got the highest rating in a Gallup poll, as a country
Yes.
which has been most successful.
And they've not taken up mass testing as the sole strategy or the prime strategy.
Right.
But if you just compare, for example, some of the countries in Europe as well as in South America, you'll find that the testing rates are markedly different, with Belgium having much higher rates of testing, but also having one of the highest death rates.
So there are a number of contextual factors which
Sure.
must be taken into account.
Sure, I take your point. I want to also tell our viewers the positivity rate, that's the ratio of confirmed cases to total tests conducted, is lower in South Asia. So even while we may be testing lower, we are getting a higher number of positive cases. Dr. Akhtar, I want to come to you again. I want to understand, in a country like Pakistan, how easy has it been to implement the lockdown, to explain to people the need for social distancing? How easy have you found it there, ma'am?
I think it's not that easy to convince general public because there is a mix of social things. There are so many people.
For example,
who are,
namaz. Have you been able to
yeah.
convince people don't gather for namaz in large numbers, don't congregate at mosques? Has that been successful, that campaign in Pakistan?
In some of the areas, it's quite successful. I feel that the people where the education or the literacy rate is higher, the people are able to understand the things. But still, I feel that there is a lot more to do because in most of the rural areas and in the places which are very much crowded and the literacy rate is not that high, we need to convince them. So I feel that there is a lot more to do in the coming days to convince people. I feel it's not that easy. In some of the areas, we are able to do that, but not in all the areas. So this is basically a fact. Our government is trying to, convince the people that during the month of Holy Ramadan, that everybody wants to go to the mosques and, it's a very sacred month for all of us. I feel that in the coming days we will be able to comment on that more, but still I think we need to convince more and more people, but I feel that it's not that easy.
Right.
But at the same time, yeah, we have to work on that.
Especially in rural areas, right? Your real challenge is in rural Pakistan, you believe, but so far the virus has been confined largely to urban pockets in Pakistan. Am I correct?
Yeah, you are very right. It's very correct that the people in the urban areas are more affected. I think it's because of business and trade and all that. The people are more concentrated in the urban areas, and areas are more congested. So that is the reason. But I think I feel that because of the social distancing and all that, and better quarantine facilities and early tracing, I think contact tracing is going very well in Pakistan.
That's
so I must,
that's very reassuring to hear. Very reassuring to hear that you're.
The government is very much, keen to trace the family members.
Imran gets a 60%. Imran has got a relatively better rating on coronavirus than on the Imran Khan government and on other issues. General, just to come to you very quickly there in Sri Lanka, will Sri Lanka be, you've said 25% of your country is under lockdown. How are you being able to ensure that the remaining 75%, are you saying that people are allowed to move freely in the remaining 75%, commercial activity carrying on in the remaining 75% of Sri Lanka?
Yes, it's like this. It's during the night we have enforced curfew, but all essential services are happening. Even in the lockdown areas, the essential services are on, absolutely no problem. Certain officers are working, but we have been able to, like what you ask about the outside. I mean, 75%. Yes, they are totally working. Totally as usual.
So commercial activity carrying on? Commercial activity general is carrying on in 75% of Sri Lanka?
It is carrying on, but as you know that the lockdown areas are mainly in Colombo and the western province where most of the commercial activities are on. But majority or the other areas are when you say out of Colombo or out of the capital, these are the areas that are open right now. And we have provided, I mean, those areas are basically from morning 5 in the morning till 8 o'clock. It's totally open and it's like normal. But we have been able to convince the people of our country about the social distancing, the best practices of medicine that have been done well.
So there's been a strong communication. You're saying there's been a strong communication education program. You have a high level of literacy in Sri Lanka. No doubt that has helped. I just want to come to Bangladesh for a moment once again because, Professor, in terms of primary health centers, Bangladesh has been an outperformer in recent years. Is that been a major factor that has helped you? The fact that your primary health system is strong in Bangladesh, and is your lockdown going to continue for much longer?
Thank you very much. I think we have appreciated the primary health care, what we call community clinics in the villages. It's been well recognized around the world. I'm sure that has played a role, and that has played a role to convince people to what to do and what not to do, how to wash and not to go to the market and etc. But I think one thing we have not discussed, all of us, is the leaders of our country. Our role of Honorable Prime Minister Sheikh Hasina and Modi ji came together to all the leaders of the nation that we are discussing and discussed this thing very early. And surely that has played some role, definitely a big role in convincing people that it is a serious issue. So we must give the credit.
So you think that the leadership, Mr. Modi is getting very high ratings in that Gallup poll, 83%. It could even be going higher in this month's poll. So you're saying the leadership has played a role. Very quickly, sir, but how long will the lockdown continue, you believe, in Bangladesh?
I think this is going to continue till the 6th of next month, but I think that means it will more or less continue. And next 2 days is the holiday, so it will be effectively about 10. Whether we will increase after that or not, we'll have to wait and see. Hopefully we'll going to see the top or the peak very soon. Right. How soon, nobody can comment, as you know.
That's but the problem. Nobody can comment. In fact, Jacob John, regarded as one of the most eminent virologists in this country, formerly with the ICMR, he has said, remember, South Asia has perhaps experienced COVID later than the West. Dr. Runa Jha, in Nepal, is there a lockdown at all in place, or is Nepal opening up? Is Kathmandu opening up?
No, it's the entire country has been in lockdown since March 24.
Right. And you will continue till when? No idea at the moment?
Yeah, no idea. It's a high-level decision, but at present, it seems that it will get extended for some more time.
Okay, Dr. Reddy, in conclusion, India, the big brother, what is great about this discussion is that why don't we do this more often? I'm told that yesterday there was an attempt to connect the 5 capitals. Prime Minister Modi took the initiative of connecting South Asian capitals. Why doesn't this happen more often? Why don't doctors, experts across this region talk to each other more often? Maybe this is the way to melt boundaries.
We do, Rajdeep, but not necessarily on television.
Yes.
We do keep connected with everybody else across in other countries. But we do need many more fora where we can actually exchange scientific experiences, form collaborative studies, and benefit from each other's learning. I think that community of learning is absolutely necessary. Just as social solidarity is necessary within each country, we need global and regional solidarity to provide a global trust to defeat this global threat. Right. And I think particularly in terms of science, we have the most unifying and absolutely selfless human platform available.
Mm-hmm. Well, I really appreciate all of you coming together. I know you all face challenges. Many of you are hands-on in this fight against COVID. It has been truly for me a special experience to bring the 5 capitals together, and hopefully the SAARC spirit will prevail. And it's good to see that the countries of this region have taken COVID seriously and been well prepared. Good to have all of you. Thank you very much for joining us. Once again, happy Ramadan to my guests from Pakistan and Bangladesh. And let's hope that the spirit of Ramadan will conquer COVID in a way. And let's keep social distancing in particular as our mantra. Thank you. Or physical distancing, as I prefer to call it. Thank you all very much for joining me here. It's a unique South Asian roundtable that you've just witnessed. Part of India Today's continuing attempt to try and ensure that we cover COVID in truly a comprehensive manner.